thank you so much for giving me the opportunity, both Wells Fargo and the North Carolina Council for Women and all the other wonderful organizations who made this report possible, to represent our second issue of the status of women in the state of North Carolina. It's a great privilege. It's also often a great pain to have to work on these issues, because you kind of work on the same issues again and again and again, and sometimes you think you're stuck in sand. But being able to do this twice, since the first time the report was published in 1996, allows us to see some of the markers of change and some of the areas where really, we need to continue to work and struggle. Just before I get into some data on the report, I would like to just say a little bit about the status of women in the states program at the Institute for Women's Policy Research, and we are kind of a think tank in Washington, D.C. We set this up in the mid-90s, really to put women on the map, on the policy map, and to gather the data and make the data accessible so that women could use it to inform policy, that policymakers would be pushed to recognize that there is a diversity out there in the population. It has women and it has men, it has different kinds of women, different age, different race, different background, and good policy needs to be based on differentiated data. So what we try to do is gather the data in an accessible manner, and we hope that this report continues that tradition. And secondly, to use it to create benchmarks, to benchmark one state against another state, to benchmark time, to create kind of a baseline so that you could say, have things changed, haven't they changed, and then ask the questions why. And in this latest report, that's the next slide, to also include regional diversity. The report is available online, and it's got a lot of data. It's a hefty tome, and we try to cover the kind of key areas from work and education to economic security and poverty, and health and well-being, including health services, and just to put the basic parameters out there so that they can be used and grabbed to make better policy and make sure that nobody falls through the cracks. And then to look at political leadership and civic leadership, to say, okay, how are women doing? How can we get more women out? How can we make sure that at all levels of decision-making, women are equally represented, and how far have we got there? And finally, we try to provide a baseline. How many women are single? How many are married? What's the age profile? What's the race and ethnic profile? What do households look like? As I said, we're trying to provide a regionally diverse picture, and in this report, and North Carolina report was the first one where we could do this. The second one, we also provide a regional overview. And we're very happy that we really thank Women to Women for supporting this effort. And there's a briefing paper which pulls the key data out for the Greensboro MSA, so that you can kind of benchmark or compare or just have the local data available for Greensboro, for other areas in the states, and compare the state to other states in the United States. So kind of multifaceted way of looking at it. We also try to make sure that people don't forget that not all women are equal, and that experience differs to some extent according to where you're from, what your race background is, what your ethnicity is. And one of the biggest changes in the last 20 years has been the changing composition of the population in North Carolina, and particularly the growth of immigration. So if you, whoops, where's the pointer? So if you look at this, firstly, immigration has more than tripled the number of women who live in North Carolina who were born outside of the United States. Has more than tripled from 2 to 7% of the female population, and the number of Latinas who live here has grown even more from 1% to 8%. So during the last 20 years, North Carolina, or bits of North Carolina, have become centers of new migration, immigration, and that brings a new set of policy priorities. Anyway, let me share you a few specific findings, and as I said, it's all on the web, so you can all look at it, and I won't keep you too long between now and lunch. Very wary of it. So let's look at employment and education, and let's start with some real positive changes over the last 20 years. So, I have to do this over my back. As you can see, firstly, education has been a big change during the last 20 years. Now, over a quarter of women have at least finished four-year college. And women are more likely than men. It's not much, but and in Greensboro it's just below. But you know, women are as, if not more, likely than men to have higher levels of education. And at the same time, an even bigger increase has been the number of women who work in professional and managerial jobs, in the jobs that need the highest level of qualifications and have the highest status or the highest decision-making power in the economy. And women actually are the majority of those workers, and they're more likely to work in such positions than men. 3 out of 10 men work in professional managerial jobs, and 4 out of 10 women. Big change over the last 2 decades. And Greensboro, you can see the figures down there, is kind of just has almost seen as much change. Has this closed the gender wage gap? No, unfortunately it hasn't. The gender wage gap, and you can see, is in every region you look at, women earn less than men. In every single region. There is a diversity, but the issue is that the regions with the lowest wage gap aren't necessarily the regions where women are best off. It often is the regions where men earn less, so where overall earnings opportunities are lower. And so you kind of, a low wage gap can mean everybody shares in misery, or it can mean everybody does well. And where the areas where the wage gap is the biggest tend to be where earnings are the highest, and women kind of get, left behind because they're less likely to be in the highest paid or highest level of decision making. Now, what does the wage gap mean? It means that women are more likely than men to be poor, and it particularly means that women who had families are more likely to be poor. The way we measure poverty is as a kind of household concept, which is right. So if you have a woman who is poor, it typically means that she lives with other people who are poor, and very often these are children who are poor. So if you look at Greensboro, the briefing paper has the single mother poverty rates county by county. If you take a county such as Guilford, of all households with kids, 3 out of 10 are headed by women, right? So 3 out of 10 households with children under 18 are headed by single mothers. Of the households with children who are poor, over 60% are single mothers. So really, how we support women who work makes a huge difference to the current generation and to the next generation. And it's access to childcare, access to transport. And if you take the wage gap, you know, it's kind of $7,000 on average each year that women fall behind. That means if you had those $7,000, you might be able to buy a better car to help you navigate childcare and work easier, to invest in classes for your kids, to get better stuff, better health care for yourself. Huge difference. So poverty and the wage gap is intimately connected. Now, switch to a different issue, health care. 21% of women aged 18 to 64, because we assume older women have access to Medicare, do not have health insurance. Oops, have I got? And you can see here, 20% is a lot, right? But you can see among immigrant women, it is almost half who don't have access to health insurance. And even though the figures are slightly better for native-born, with 20% of women, this is bad for who don't have health insurance. You might have health insurance and it might not cover everything, but not to have any health insurance probably means A, you don't get any wellness visits, and B, you might have to go to emergency care when something really bad is happening. So it's bad for the women and it's bad for all of us because the costs go up. So it's inefficient as well as unequal. So what we also try to do is put basic health markers. The report has lots and lots of data. I just picked out one of these looking at mortality from breast cancer. You can see actually this is an area that has improved over time, but there are big diversities between groups, and African American women are more likely to be the victims of breast cancer. So we have similar data for all those kind of range of health issues, and including, we include rape and sexual violence, so to really provide a rounded picture of health and well-being, and provide pointers of where intervention is really necessary and where it might be most helpful. Okay, finally, political participation. So, as I said, we need women to be in government, in elected office, in executive positions to ensure that women's issues are heard. And there's a lot of research to show that when women get elected into political office, women-centered policies actually are more likely. They're not guaranteed, but they're more likely. You can see women are more likely to vote than men, but a lot of women don't vote. So there's still a lot to be done in terms of mobilizing. And then if you look at who actually goes through the effort of being elected or the trouble of being elected, there are a lot of women representatives, but far behind men. So women's voices are not getting through in equal numbers. Executive office is different, and women elected to executive office are doing better in the state, and it's 50-50. But in the decision-making points, in the legislature, in the state and nationally, women are really underrepresented, and so we're not getting our issues heard sufficiently. So, in conclusion, you all know this. Women are an integral part of the community of North Carolina, of Greensboro. And women are families, women are communities. If women are not doing well, it's unlikely that the state of North Carolina will do well. So for the state to prosper, we need to invest in women. And we hope that we put the data out to do this. Because as the report shows, we compare all these issues for women and men. Women and men very often have different experiences, different barriers they need to overcome, whether it's at work, in education, in health, in old age. as girls, as we heard. So you kind of think, you know, policymakers want to make good policy, so they want to know how they have to impact the reality they're trying to change. So you need gender differentiated data, but still people don't hear it. So what we hope with this report is that we put the data out there so women's interest and their concerns in their diversity can be heard and will be heard, and that advocacy makers can push to make sure they're up there. Thank you.